Welcome back, guys. Today we've come down to Imperial College London at the Hammersmith Hospital campus to speak to Dr David T Dexter.
Thank you very much. Thanks for coming.
Could you just tell us exactly who you are and what it is that you do, please?
I'm Dr David Dexter and I'm a neuropharmacologist, and basically I research into Parkinson's disease to try and develop better drug therapies.
What exactly is meant by the term neuroscience?
I think neuroscience relates to anything looking at the functions of the brain and the peripheral nervous system.
Is there any particular area of neuroscience that excites you more than others, and if so, why?
I think really what excites me is basically what goes wrong in these diseases that affects us as we age, like Parkinson's and Alzheimer's, and the challenge is to develop better drug therapies for these people.
Why is neuroscience such a hot topic at the moment, and why do you think it's important that we're having this debate?
I think it's become a hot topic because as we develop better drugs for treating heart disease, cancer, we're all living longer, and the chances of developing these diseases that affect the brain, like Parkinson's and Alzheimer's, more of us are going to become affected by them, so it's the next big challenge, and that's why it's become a focus.
With today's technology and all the scientific evidence available to us, what do we really know about the brain?
I think we understand quite a lot about the basic mechanisms, for example, like how nerve cells talk to each other, but it is still quite a big black box, really, and we really do need to do a lot more research.
What would you say are the positive things that come from understanding more about the brain?
Well, the positive things is if we can understand how the brain functions normally, how it's affected in disease, we can obviously develop better drug therapies and potentially cures, so that these people can actually age healthily rather than having their memories disappear and things like that.
And what do you believe are some of the challenges about increasing our understanding of how the brain works?
The challenges for society, obviously, is we understand more about the brain. We can then say, this person is going to be susceptible to this type of disease. So then you've got the challenge of actually saying, well, X, Y, and Z people are going to be affected by Alzheimer's, and they're going to have this diagnosis. And so that's going to be a big challenge for society itself.
If any, are there any more scientific or social implications that come from understanding more about how the brain operates?
Obviously, as we become more familiar about how the brain operates, then it does raise the spectre of manipulating, the basics of who we are, like our intelligence, our memory, and things like that. And obviously that raises ethical problems that society really needs to address. Is it ethically right to develop drugs to increase memory?
In your opinion, in the future, will it be possible to cure diseases like Alzheimer's, Parkinson's, and other genetic diseases?
I think we're getting to a stage where we understand these diseases a lot better than what we used to do. And so more drugs are coming through to clinical trials. So I think we'll first develop better treatments, and then hopefully we'll develop cures. So I think it is in the not too distant future, but we shouldn't get people's hopes up that it will be in some people's lifetime.
What about illnesses like depression and things like addiction? Do you think we'll be able to cure or remove these things in the future? And if so, what implication will that have on us?
I think cure is a bit of an emotive term. I think better treatments are certainly within reach. Cures are probably a lot further down the road, really.
Whether we're talking about the illicit use of illegal drugs or the use of medications, do you think we fully understand enough about our brains to be able to take these mind-altering drugs?
No, I don't think we fully understand enough about the brain to actually say what the consequences will be taking of any type of drug which will affect the brain, whether it's a prescribed medication or an illicit compound. And really, we still need to do more research before we can say, what's the long-term consequences of taking an illicit drug. Yes, it might not show any immediate damage, but long-term, say 20, 30 years down the line, you may see changes.
In your opinion, how can we regulate the use of such drugs and medication?
I think you need to regulate them on an ethical basis. Yes, it may be a prescribable medication, but is it ethically right that you actually give the medication to these groups of patients? I think that's a key thing to it. Is it ethically right to actually prescribe these medications rather than just being medically available?
Thank you very much.